Joints. For true ankle joint swelling, the physician will put his hands around the ankle and using his thumbs, palpate the joint space between the malleolus and the Achilles, feeling for fullness or bulkiness. He or she should try to ballot fluid with his or her thumbs with enough pressure to whiten his or her thumb nails. The physician pushes with one thumb, then the other. For MTP joint swelling, doctors use the four fingers technique, similar to the MCP swelling technique in the hand examination. Remember that the MTP joint space is actually 1 to 2 cm proximal to the wedge space. Supporting the joint with his or her middle finger, the examiner should palpate the joint with the tips of his thumbs, roll the tips of his thumbs in and out of the joint space, feeling for tenderness, synovial thickening, and effusion, and try ballotting fluid back and forth. The doctor has to palpate the PIP and the PID, also using the four-finger technique. Try ballotting fluid back and forth. Another aspect a doctor should look at is dactylitis, which symptoms include swelling of one or more digits, often the entire hand or foot, and which may be painful upon movement. Neurologically, the physician should finish off the palpation by checking for a Morton's neuroma, which is due to an entrapment of an interdigital nerve rather than a true neuroma, and often occurs between the second and third, or third and fourth toes. It presents a lancinating pain in the affected cleft and adjacent toes. The pain is made worse by compressing the metatarsal heads together while squeezing the affected wedge space. A soft tissue mass may be palpable. Pulse. Dorsalis pedis artery runs between the EHL and the EDL and can be palpated as a pulsation on the dorsal aspect of the foot. Posterior tibial artery can be palpated halfway between the posterior border of the medial malleolus and the Achilles tendon. It is often examined by clinicians when assessing a patient for peripheral vascular disease.